and there are certain expectations that we see our culture putting on men, the roles that we're expected to fill.
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronski, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. Welcome everyone. I am here for a very special couch chat with Tom Jeffords, licensed clinical social worker who just joined the Dr. Susie G team. And we are going to be talking about men's mental health. Tom, welcome.
Thanks. Thank you for having me.
Of course.
Yeah, glad to be here.
So, talk to us about the stigma and the embarrassment around mental health, in particular for men. Why is there such an embarrassment?
Well, okay, so it's interesting you put it that way, right? I think that stigma and embarrassment, they got to come from someplace, and it's not necessarily something you're born with, right? So I do think that a lot of it comes from the culture that we're brought up in to some extent, and there are certain expectations that we see our culture putting on men, the roles that we're expected to fill and fill perfectly, right? And so if there's anything at all that is keeping us from performing the way that we think we should be able to, oftentimes we don't ask for help. We just think that there's something inherently wrong with us, and that's kind of problematic, because sometimes it's just you're not wired the same way that other people are wired.
Right.
And we're all supremely individual when it comes to certain parts of this, and I think it's really important to explore that and see what that's about.
Right. Why do you think it's so hard for men? And I don't want to stereotype or all men, but in general, the folks that we work with, there's often a reservation to address the mental health aspect related to maybe a particular physical difficulty that they're going through, pain, sexual dysfunction, etc. Like, why is mental health like almost the last thing to address when it comes to overall health and wellness?
Right. Great question. That is a great question, because honestly, I do think that there are certain times when obviously you need medical attention, but then other times, if you're taking care of yourself mentally and have a pretty balanced or centered view of the things that stress you out, the versus the resources that you have to fight those stressors, maybe you're experiencing pain or setback in a different way all of a sudden, and so I'm not exactly sure why it comes later than medical care, but it makes sense to me that it does, honestly. That, if there is something that feels not right in our bodies, we're going to go make sure that there's something, something medically wrong first, I think. Because, culturally speaking, makes sense to me too, that like, if we can fix it quickly, let's fix it quickly, right?
Right, yeah.
And so...
Which is okay.
I don't
There's
even know
a
if
time
that's
and a place for that.
Right.
Right? Like, we certainly want to address any biomedical aspects, but there's this almost a sense of duality. Like, if it's not physical, then it's mental. And there's a separation between psychological parts of our biology which matter, which are actual physical processes, which I often tell people that I work with, like, it's not separate from. I mean, we don't just chalk it up, we can't find anything physically, so it must be all in your head, it's a mental issue, go get help for that. Like, that is not the message, that is not the conversation that we're having with people, because there isn't this duality or separation from, your psychological biological processes and your physical biological processes. Like, they both play on each other. Man.
And they're finding more and more connections every day, which is remarkable. I came to my master's in social work and clinical social work a little bit late in life. It was a career changer. And so in the last 5 or 6 years, I'm very aware of the fact that there's a real concentration on the neurobiology part of all of that. And it is fascinating to understand more and more about how we can support our nervous systems in a way that change our perspective on pain or things that activate it, or anxiety, depression, all of those sorts of things. I was reading. I'm not going to be able to remember where I read this, unfortunately, and no, it wasn't TikTok. But it's a great place to start. Don't get me wrong. But the idea that even our self-talk, our nervous system can't necessarily distinguish between self-talk and putting yourself in a dangerous place of like, oh, I'm so stupid, versus a loved one that maybe was a caregiver that said the same thing to you as a child that made you feel unsafe. Like there is no difference in your nervous system. The same effect happens with self-talk versus those earlier experiences. It's remarkable.
It is so remarkable because it is essentially down to a nanomolecular level that your bodily protective systems are recognizing, recording, fine-tuning, updating based on your experience as a human being. And subconsciously, these non-conscious processes of our protective systems are always operating. They're always operating.
100%. Trying to keep you safe.
Right, try to keep you safe. And so this is great into my second question to segue into this, that we
can I just say one thing real quick?
For sure.
On that same idea, while it's true that like all of this is happening on a subconscious and really like molecular level, literally, I do think it's important to note that like there is so much plasticity around like how we can help support ourselves in those moments too, right? It's not fatalistic. It's not like this has to be the way. There is a lot of help and support out there for you.
That's right, and thank you for bringing that up.
Yeah, of course.
Our bodies are, as Lorimer Mosley and David Butler and all the giants that I ride on their shoulders regarding neuroscience and pain, etc., our bodies are bioplastic, this neuroplasticity, always changing moment to moment. And there's a wonderful quote that Lorimer shared with us a couple years ago in a mastermind that said, change is inevitable, but how we change is not. And so I think that just summarizes so beautifully what you had just shared about our bodies adapt. Our psychology, our biology, and all the experiences in our body and beyond are adaptable processes. And so there's hope.
And there are lots of things, though, that affect that. Not only the things inside of our body and outside of our body, but also like the social environment that we're in, all of our experiences leading up to this moment inform what's going to happen inside. Absolutely.
Social support, connection, and this is research even around men's health and general musculoskeletal chronic illnesses, pelvic pain, that social support is a greater prognostic factor for recovery than any other aspects to one's health journey. So that social support, camaraderie, the uplifting, there's a lot of support, but it may be very nocibic or negative. And we know that nocibic language, nocibic narratives, negative narratives impact the protective systems. So
100%. Additionally, one of the not criteria, one of the outcomes that I'm aware of as far as social support that's positive too, right? That feels good, is it's the primary indicator for likelihood of quality of life as you age.
Absolutely.
Just generally speaking.
Absolutely. And that goes for not just chronic illness, but even just overall quality of life, perception, and sexual health. I just want to add that in there. Sexual health and quality of relationships and dynamics and how you feel about yourself, all those things.
And that word that is so hard to pin down the definition of happiness.
Right. Yes, exactly. So talk to us about, so we do work with men who have difficulty with pelvic pain, sexual pain, chronic illness, also sexual dysfunction.
Right.
How can mental health support them and their partners along their journey? Talk to us about that.
Okay, so what I hear you asking almost more specifically is, working with you and your team, where do I fit in, right? Like, what is it that I do necessarily? Is that right?
That's
okay.
Perfect.
Awesome.
Thank you,
Just
Tom.
making sure.
You got it.
No. I'm like,
you got it.
well, I think it's a fair question, and there's a funny bit of overlap when it comes to working with, as a mental health clinician, working with physical therapists, occupational therapists, nutritionists. There's this very holistic approach that, as a trained social worker, like, I love the biopsychosocial aspect of all of this. And so there is, where I fit in tends to be around that last piece of the pie, right? Like, we've looked at the medical part, we've looked at what you're putting in your body and how you're able to function physically. For me now, it's about what the stories you're telling yourself about the changes that have happened physically for you in this moment. And are you able to do the things that you want to be able to do, and be the person that you want to be with your partner, to your partner, in just your life, living in this human body. And sometimes we just get down, frankly. There is a lot of depressive and anxious symptoms that come with chronic pain, fear of doing something to exacerbate it. Is this always going to be this way? You're looking back and wondering, am I ever going to be able to feel the way I used to? Or looking ahead and worrying, is this always going to be the case? And so I think there's a little alchemy that happens with the mental health piece, where we're taking all of what the clients are learning with you and Lainey and Jason, and figuring out, and people like yourselves as well, not just you, but and figuring out how to implement that mentally. Because I think if there's no buy-in, if you don't really understand like the benefit that comes from those things, not just physically, not just metabolically, but also mentally, like, this is where I get to shine. It's a little bit of psychoeducation around why we're doing what we're doing, but then also an enormous amount of like meeting an individual where they are and asking, what are you struggling with right now? What is it that you're feeling as though you want to be able to do differently? What do you feel like the thing is that's keeping you from being able to do it? And so there's a mixed modality approach to this. Some of it is very much like solution focused, where it's like, here's my big goal. It feels impossible. So how do we break it into smaller steps, right? And so that it's approachable and accessible, and you can build on smaller successes. But I think there's also some like compassionately, like, attuned conversations to really kind of hear where this person is coming from and a little bit more about their history, and to try to sit with them in order to help them accept what is in this moment, so that they can base future decisions on, what the reality is, as opposed to the stories that we tell ourselves about the roles we're supposed to play, or any of the guesswork about the future.
Exactly. And thank you for bringing up having a space to express and share what's going on the inside for a lot of us, because in these situations of chronic illness or pain or sexual dysfunction, I know from my experience as a human, but also working with men, is that we can feel very isolated, and it can feel very isolating. It can be very like, I'm the only person on this island, and no one else is struggling with these things. And there's so many people that have their own internal struggles, physically, emotionally, and that you're not alone. And the expectation that you should have to deal with it on your own, I think, is a big farce. So, the fact that we're having this conversation and really, welcoming this conversation and your
encouraging it even.
Exactly, encouraging, leaning into these often vulnerable spaces, because as Mark Hutchison, who is a neuropsychoimmunological researcher, that's a mouthful, he said in a presentation that I had the privilege of being part of, is talk therapy is like surgery for your nanomolecules. And they have research that shows in real time that being able to share and talk and connect with another human being, if you're struggling with something, that your biomarkers change. Change in real time.
That's amazing.
It is quite amazing. So it's like you are doing such tremendous physiological change by connecting with another human being who is able to embrace and extend compassion and almost like envelop you in that compassionate space. How wonderful.
Yeah.
How wonderful.
Well, thank you. Thank you very much. I'm going to look that guy up. I'm not familiar with him.
I had a podcast with him. Check him out.
I will.
It's on the YouTube, on the channel. If you haven't seen it, everyone, definitely check it out.
This lady's talked to everybody.
I try. I mean, all the people that really inspire me and have really shaped my personal and professional career, I really do admire. And like I said, I ride on the shoulders of many giants that have helped me get to this point of being so integrative and comprehensive and taking into consideration the humanistic approach, person-centered, person-first care, rather than this traditional, conventional, purely biomedical model, which is very limiting, very, very limiting in many ways. Important piece, but limiting. There are limitations to that particular mindset and model of care.
There's all of what you just described kind of reminded me of, there's a wonderful, not a catchphrase, but it's a beautifully put couple of sentences around the gist of what you're describing there, where it's like the work that I want to do, the work that I find myself very satisfied in doing, is finding a way not to fix another person, right, but to meet them and show them that this particular concern that they've got, this particular constellation of concerns that they've got, they're big enough to hold all of those things. That, you know, this container that right now chronic pain maybe is the thing, or sexual dysfunction is the thing, and you become very myopic. It becomes very like, this is all I can see. But even that's kind of language now that we're using around like activated nervous system, right, where fight or flight narrows your vision. And so what I think that I do in a way is provide a space for folks to feel spaciousness and regain that peripheral vision so that they can see other options, right? Sometimes options that they've had all along and have just forgotten that they had.
That's right. And how empowering is that, right? To the resiliency piece resilience is is experiencing adverse situations and feeling like you have enough confidence and resource and power within yourself to overcome, and not just overcome to survive, but overcome to thrive and grow and be bigger, you know? So that's fantastic, because that's exactly the model of care that we embrace, and that we really empower others to understand that we're just here to support and guide and offer, you know, a particular structure, like a riverbed, right? The riverbed, there's some fluidity within that. Like a riverbed has maybe some dirt, maybe some edges, but ultimately the river is flowing, and it's flowing in a particular direction with a little bit of flexible structure. And that's kind of how I like to envision our process of fluidity and allowing that person, like we are the edges of that maybe riverbed, but that person has so much flexibility within that riverbed to continue to grow and just flow and go and no matter what obstruction, you know, water just flows through.
Right.
So
100%. And I mean, there's a concept I've been playing around with in working with certain clients around this idea of there's that riverbed and that river, and if you're trying to cross the river, you don't know what lies in the river. You just want to get to the other side.
Yeah.
And at some point, you have to enter the riverbed, right? There is a power, I think, in understanding that there might be moments of groundlessness, or where you get caught up in the current of that river, but it's almost more valuable to you to make it to the other side. So whatever it ends up taking, you're gonna do it. When you're in there, you won't even know what kind of help to ask for until you get in.
That's right.
But you do have to take that first step.
Oh, that's right. How much courage.
Right?
Yeah, courage. That we all have, and that you have. So,
we're not fragile.
We're not fragile.
Like that is the fragility piece to chronic anything, where it sort of feels like I'm not going to make it. It's pretty remarkable, the confidence that can be built after just trying some things. Right. You realize that you're not quite as fragile as maybe you thought.
That's right, and you might actually come out of that thinking, "Wow, I'm much stronger than I thought I was." Right? So that's awesome. I do want to circle back to the question about men and mental health, and in your experience, if there are any unique mental health challenges that men struggle with compared to others.
Well, I do think it's a great question. I mean, I sort of feel like, percentage-wise, it's less that they're unique and more just it seems like maybe this is a thing that men struggle with, but women are likely to struggle with it too. I want to say probably the way that I would answer that is anything that goes contrary.
Tell us more about that.
Anything that goes contrary to, if you are holding fast to a gender norm or a cultural role that you're expected to play, and if you find yourself not necessarily fitting into that or being able to perform in that way, I think that there traditionally has been fewer places in U.S. culture for men to go to kind of figure that out.
Right. Where does perfectionism fall into that? Right. We do work with a lot of very determined, high-driven individuals, and when, as you're mentioning, if something goes contrary to the expectation or what
around performance
metric of success, exactly, performance, and that could be career, it could be relationally, it could be sexually, whatever it is. Where does that fit in as far as perfectionism and masculinity or the male attitude? And again, I'm not here to stereotype or genderize things, because all people can experience these things.
Exactly.
But because we work with this particular population, I do notice it's just an observation.
Oh yeah, what have you seen?
Well, yes, it's what I'm describing.
Oh no, of course,
essentially.
Of course. Yeah, no, and 100%, right? I think when something goes against those core beliefs, those limiting kind of we've over-identified with a goal that may or may not be our own, frankly, then it really does sort of hit us at the core of who we think we are. And I think that's problematic, to say the least.
Right.
But in the lens of perfectionism, we really beat ourselves up about those shortcomings. And I think, we talked a little bit earlier about the multimodality approach of starting where you're recognizing what is and being able to accept it, or at least change your relationship to what is for the moment, right? It's not necessarily always going to be this way, whatever the challenge might be. Things change. Things are constantly changing, like you quoted earlier. And so I think addressing that first and attempting to bring some awareness around what is that story that culture is telling you about yourself, that you're just identifying with and trying to hold on to and make something that isn't necessarily the case.
Right.
Yeah, so awareness is huge. Curiosity is a huge way to address that. But perfectionism, generally speaking, is Is it overstating it to say it's like an pandemic?
Yeah, no, not at all.
men.
Not at all. I've fallen victim to it, and there are still continue to be threads of that narrative that these internal rules that I never created but follow for some reason and try to make it work. It doesn't work that way, and it takes time. It takes time to bring in some introspection, awareness, and really reflecting on one's life of like, hey, is this really in line with my values and how I want to engage with myself, but also as a human engaging with the world and the world engaging back with me, you know, and
what
really,
do I want?
Yeah, right, exactly. Not what other people want or expect of me, because that's when we butt heads with our biology, and that's where that like physical tension comes from, emotional distress comes from. It's all part of the same cycle that we find ourselves in.
Yeah, it sounds a lot of the language that you're using just is confirming to me that like there is so much overlap in your approach and Lainey's approach and Jason's approach with the way that I work as well.
Yeah, it's quite special.
Yeah, it's pretty neat.
Yeah. What are some signs that indicate someone should seek mental help?
Okay, yeah. So I'm going to answer in a kind of roundabout way. There's a lot of talk, even on social media and stuff, around disorders, and it seems like people really want a label to kind of help them, like, identify, I think, with the things that they're struggling with. But the trouble with that is that, again, that over-identification, I think, once you have a label. And, you know, there is a, in mental health, there's the diagnostic and statistical manual that addresses all of the criteria of what makes a disorder a disorder. And what it comes down to is disruption of functioning. And I think not everybody on social media has the thing that they're thinking that they have. Yeah. We all have little bits and pieces of so many of those things.
That's right.
But we don't have enough of the criteria. It's not disrupting our life enough to become a disorder. I think the key here, in my world anyways, is if you are finding that like the resources and support that you have are not enough to get past some of those stressors, whatever they might be, and it is causing disruption in your life. I can't get out of bed. I'm not making it. I'm calling in sick to work a lot. Let's see. Relationships are going south. I'm not eating. The things that I used to enjoy, I'm not enjoying them anymore. You know, that sort of a thing, where it's really disrupting. And keeping you, or disrupting your life and functioning in different settings like work, school, relationships, but also you're just not able to get past it for some reason, right? I think that that's a huge indicator that it might be time to talk to someone professionally about what's going on for you.
And if someone is, you know, has that courage to do that, how do they know what mental health therapist is right for them? Because that could be a challenge. I mean, I know that I myself have gone through that process of working with several providers, and it's not just mental health therapists, but how do you know that a provider is a good fit? You know, what are some pieces of advice when someone's looking for a mental health
awesome
therapist?
Question. And I didn't even let you finish asking before I started talking. I apologize. But it's such a good question. It's literally like the key, honestly, because research shows that almost more than anything else, the thing that is an indicator that you're going to get some positive outcomes from a mental health treatment episode or working with a therapist is your connection, your relationship to that therapist.
No kidding.
Yeah, that is the one thing. So I think, you know, there's a lot of databases out there that like show you who's a therapist working in your area, who's available, and they'll tell. It'll provide a little bit of information about the kind of work that they do, the kind of trainings that they've gone through, that sort of a thing. So if you're online and looking for mental health therapists or clinicians in your area, There's a boatload of places that you can start looking. Psychology Today. If you have an insurance that you're wanting to use as payment, even those insurance portal sites can provide like a list of people that are accepting your insurance in your area. That's a great place to start. But you really want to look at if those people have an option of like a quick consultation call, usually maybe 15 minutes, something along those lines. Often it's a free kind of almost interview time for them to get to know you a little bit about what is going on for you and what sorts of things they might be able to do with you in therapy, but and like how to use therapy, but also for you to get a feel for what it might be like to sit across from them and interact with them. I think it's so important. And honestly, what I tell every single person that I interact with in therapy, this is your treatment, right? If I'm not actually doing the thing that you're hoping that I would do, I'm open to feedback. And if I'm not able to offer a service that you were hoping for, I'm quick to say that, because I don't want to waste your time. I don't want to stand in the way of you getting the help that you are looking for.
Absolutely.
But a lot of what we're talking about, getting the help that you're looking for, involves that like awareness of what the issue is, curiosity around it, what has worked for you in the past, what do you feel like you still need support around, those sorts of things. And so, yeah, that's my suggestion, I think, is do a little bit of homework, but also put the potential therapist in the hot seat. What's it like to sit with them? Ask them questions about how long they've been doing it. What to expect meeting with them on a regular basis.
That's right. I love it. And it's a collaborative partnership. It's not a one-way, my way or the highway kind of situation, which I feel like some of us can really relate to as far as engaging with other healthcare providers or clinicians, and that's not what we're about. It's really about a partnership, collaboration, and ultimately youth-centered around what we're doing. And so the trust and building that therapeutic alliance and that container for everyone to be genuine in that space is really, really important for the way that we work. So,
very well said. That's what I say.
Thank you, Tom. Well, I have one last question for you.
Okay, sure.
How can partners support men if their partner is a male identified person, like how and who they're struggling with some mood issues or mental health challenges and even just physical challenges that are impacting their mood? How can partners support them?
So it's hard to answer, across the board, right? Because there's always going to be idiosyncrasies in every relationship. But I think so much of that comes down to communication. That the partner may be recognizing, hey, my partner is seeming depressed or down, not quite responding the way that I would anticipate. So I would suggest being curious about that, not judgmental. I feel like the judgmental part is kind of the thing that you're almost expecting to happen in our culture is, I'm showing weakness, or I'm showing something that's not male bravado, and so I'm going to be judged and seen to be lesser or not quite a man. And so I do suggest curiosity over judgments, and just clear communication. If they're not ready to talk to you about something, though, maybe give them a little bit of space. And if that's the case, still letting them know that you're there when they're ready to talk, right? That you're wanting to be a support to them when they're ready for it. And then asking them how they would like to be supported also.
Such a good point.
That's kind of the
Not making assumptions, right?
Yeah,
Right.
Indeed.
Oh, I love that. Right. Asking like, hey, I'm noticing or I'm observing this particular change in you, and it's concerning me, and really speaking from a heart-centered place. As you're mentioning, not being judgmental, I think is a huge piece to that, not being critical. Because often we can be feeling our own feels as the person on the other end of like, well, you're not being yourself, and that's also impacting me as an individual, and like, and then really underneath that is fear of, I know something's wrong, I just don't know what to do. And you know, it's coming from a place of care and love, because they genuinely care and love you, and they feel really like that it's out of their hands. And so I'm so glad that you brought that up.
But with that in mind too, I think that you know, all of the care and empathy and compassion in the world kind of is it's overlooked, I guess, if your languaging is aggressive in a way. Boy, that's really vague, but if the other person takes it to be aggressive, they're not going to respond well to it.
Valid,
And so, you know, that curiosity piece, I think I was attempting very ham-fistedly to talk about just a second ago. It is about letting that person know, you know, your concern and how your concern for that person is affecting you. And so, it becomes a little bit more of, I'm taking responsibility for how I feel in this relationship in this moment, and it's going to make me feel like more of a partner if you can share this with me. If you are not able to at this time, I get that too. I'm still here, but please, when you can, right? And in the way that feels good to you, but just let me know what that way is. And so,
Aw, that's so tender. And
well,
very
it can be,
considerate.
right? We're talking about someone that's going through some stuff.
Right, and we have no idea because it's such an internal experience. And so, you know, if we're like from the partner's perspective, the other partner's perspective of, hey, if I'm struggling, I think it's also a responsibility to do our own work of what's going on for us in that situation, and not putting that responsibility on our partner to fix because we're feeling unhappy with the situation, right? So,
is it really care for that partner, or is it like a control thing for yourself?
Totally. Well, Tom, thank you so much. I think this has been such a compassionate conversation, and your passion and care and authenticity in what you do really spoke through this in our conversation today. So I really appreciate you being on this couch with me, and also for being part of our practice. We are so very blessed and happy to have you part of this team. It really is, and for all the people who are going to be working with you, it's wonderful. So thank you.
Thank you very much. It's been a pleasure to sit on this very comfortable couch and just talk about the stuff that it's obvious we both geek out over.
We
too,
do.
You know?
We do.
And so thank you.
Awesome. Thanks for listening to today's episode. Be sure to visit my website, drsusieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.